I'm Jane Hansen. This week in the arena, the health care reform bill. It's been decades in the making, but President Obama has done what many presidents have been unable to do for years. He signed into law a bill that helps to provide the opportunity of medical coverage to millions of uninsured Americans. But if this is such a good thing, why are so many people opposed to this new law? Joining us to discuss the health care bill are Monsignor Kieran Harrington, Director of Communications for the Diocese of Brooklyn, Grant Gallicho, Associate Editor of Commonweal magazine, and Paul Howard, the Director of the Manhattan Institute Center for Medical Progress. Welcome to all three of you. Paul, since you're our guest, I'm going to start with you. You describe this as Madoffian in structure, which of course is a reference to Bernie Madoff. So what the heck do you mean by that?
Well, first off, I'd say that obviously extending insurance coverage to the uninsured is valuable. It's a good thing to do. My problem is with the cost of the bill and how it's been structured. When I talk about Bernie Madoff-like accounting, we're talking about trying to double count $500 billion in savings from Medicare that you can either use to shore up the long-term fiscal solvency of that program, which is $38 trillion in the red in unfunded liabilities, or you can use it to pay for this new entitlement. You can't do it both. Democrats are trying to say it does both at the same time. You can't. So that $500 billion, you should count it towards Medicare. It's not. It's being counted towards this new entitlement. So that taking money from one program, shifting over to another one, doesn't take care of the deficit problem. $53 billion in Social Security revenues that should go to that program are being counted in this bill towards the funding for this new entitlement. $70 billion in a new entitlement called the Community Living Assistance Act, also there. And then you've got, uncounted in the bill, probably $100 billion in new funding to get it up and running. So you've got lots of stuff that's not being counted or ignored in the final tally of the bill.
You use a biblical reference. You say robbing Peter to pay Paul, which of course, what's the church's position on this really about this whole bill?
Well, I think there are a couple of things. The first thing is the church is supportive of covering the uninsured. I think that it's pretty clear that there are some real significant problems in our country with making sure that people are covered. 34 million people need to be covered. I think that there's a question about undocumented people and even legal citizens, legal aliens living in the United States, people, green card holders not being covered under this legislation. And of course, one of the major concerns that the bishops have voiced is over the funding for abortion. And the fix that the Obama administration proposed with an executive order, according to many analysts, that's not going to really hold up. And so there's some major concerns that we have. First, that not everybody is covered, and at the same time that this is going to further policies which we find to be immoral. That's the first thing. Second thing I think is that we can say yes, health insurance reform, health reform is important. The question is did this go about it the right way? Because there are going to be other implications. What's going to be the impact on small business, for instance? A small business, which is a driver in the economy. So, there's a law of unintended consequences here, and it seems like the way this process has sort of unfolded is a little difficult.
And Grant?
Yeah, I don't think the question of how small businesses will be affected is part of church teaching.
Really? It's in
no,
the...
it hasn't been pronounced on yet.
Encyclical.
No, look, it's a huge, complicated bill. I don't think it's perfect. I think it has serious flaws. I would have liked to seen a public option built into it. I think that might have provided more incentive for the for-profit insurers to control their own costs.
It would have put them out of business, though.
Potentially.
How do you compete against the federal government?
But not necessarily.
Yeah. How do you compete against the federal government?
I think it's very much doable.
One of the things is we already have hundreds and hundreds of insurers. What does adding a public choice option to the existing hundreds of companies that are competing now do? I agree there needs to be competition, but the level of competition has got to be the right level. We're not, the federal government's not in the business of competing with Microsoft or competing with Google just because they have dominant market positions.
But it's not a basic human right to buy Windows 7.
But you can.
Well, really, the question is health care a basic human right?
Right, and it is.
Well, I think that you say that fairly matter-of-factly.
Well, I think a lot of bishops do too.
Okay,
well,
I think
yes,
that
yes.
But I think this is something that needs to be really examined. I think that access to health care is a right. But is it a basic human right that every person have health insurance? I think there's a very expansive notion of rights here that is a little troubling, because what else does a person have a right to? I mean, if you start to say they have a right to, what quality of health care does a person have a right to? So, I mean, the question of access is one thing. The question of what's the quality of health care and the scope, that's a different question.
Right, it gets very complicated. You have to ask the question of what's the right balance of innovation in the system, providing safety net coverage for people who can't afford it, but also putting incentives in the system that drive coverage costs down over time. We can say everyone has a right to health care, but if we pay for the most expensive health care out there, we're driving costs unsustainably, and that's going to lead the system to collapse.
Paul, you don't see any cost controls at all in the
I
this
do.
law?
My concern is they're not going to work. I mean, let's take Medicare, for instance. Started out with a cost-plus reimbursement system, so they paid hospitals and physicians whatever their rate was plus 2%. That didn't work to control costs. Shifted to something called the diagnostic-related group. Creates all these weird pricing incentives. So hospitals said, all right, if you're going to pay us less for this service, we're just going to do more of it. We're going to make up money with volume.
Right.
So my problem is that the top-down controls don't get the system to realign in a way that really creates value for patients and results in better care.
And doesn't it leave too much that's vague at this point? Because some of this stuff, like an excise tax, doesn't kick in for 7 or 8 years. You've got a lot of things that further Congresses or future Congresses will have to...
These guys have certainly kicked the can down the road, and there is no question about that. And the president has kicked the can just far enough down the road to get past his re-election.
No one's ever done that before.
Well,
so you're saying this is politics as usual? Is that what you're saying?
I think that when you have a bill that is a completely partisan bill,
what does that even mean?
What does it mean to be a partisan bill?
It's completely partisan.
That they couldn't muster a Republican vote.
Well, that's because
to support the bill.
That's because the GOP made a decision not to cooperate.
I think that's really. I think that's part of the problem here. Is that I think that's the rhetoric on the part of proponents of the legislation. But the fact is, the president himself, he had a health care summit. He wasn't willing to bring new ideas to the table. He asked them to come to a summit. Then they come and say, "Listen, we need to start from a position where we can agree." That wasn't acceptable.
That's because the Republicans treated it like kabuki theater with their 7 copies of the bill, which they kept flipping through and leaning on. I mean, it was a little
part of
childish.
it. Certainly was, but you know what? Who made the decision to bring cameras into the room? Not print reporters. They could have been print reporters. It could have been.
And if he hadn't, he would have been accused of
Not
backroom dealing.
not if there were other reporters in the room.
Let's get back to this basic point, though. Is a bill, a law, better than nothing?
Look, I think it's valuable to have insurance coverage. I think maybe that's one thing we all agree on. I think how you go about it is everything. Because we do have existing programs that we're dedicated to that are unsustainable at the rate we're paying for them in Medicare and in Medicaid. You're right, there are some things in the bill that if everything plays out as intended, we saw a tremendous controversy over mammogram screenings. Should everyone should all women get mammogram screenings?
For a certain age, yes, I think they should.
But the U.S. Preventative Task Force came out with a recommendation that didn't say that, and it was a huge firestorm. My concern is by politicizing, getting government more in control of healthcare, you haven't taken politics out of it, you're injecting more of it in.
And does that get back to the basic thing about just simple rights to have health care? Does that get damaged in this process? Because that was your point initially. Where does it go?
One problem they've had in Massachusetts, and other states have had this problem too, particularly with the Medicaid program, right? We know that they pay about 60% of private rates for primary care physicians. So you have a lot of people in that program who on paper have access to health care, but they can't get in to see a physician. If you can't get medical care, what's the point of having a right to insurance?
Yeah, one of the great concerns is that the bill levies tax on people who are supposedly wealthy people making $250,000 a year or more. That may seem like a lot of money. Now, of course, if you live in New York, you know that $250,000 is not an exorbitant amount of money. But let's admit that it's still a goodly sum of money. However, think about small businesses file as individuals. They're filing. This is really not an exorbitant sum of money. And about 30% of Americans, at a minimum, are employed by small businesses. So what's going to be the impact of this legislation on small businesses?
On that note, we're going to take a quick break. You guys think about it and have a response when we come back. We'll continue this conversation on healthcare in just a moment. Stay with us. Welcome back. Our topic today is the health care reform bill that was signed into law by President Obama just last month, and why such a key piece of legislation has divided so many Americans. All right, Grant, I'm going to give you a chance to respond to what he was talking about with small businesses.
I just wanted to point out that there is an exemption built into the law that if you own a business that has fewer than 50 employees, you're free from some of the constraints that you were complaining about.
But a lot of small businesses are not 50 employees. There are people who have 150 or 200 or 300 or 400 or 500 employees. I mean, these are not big companies, and yet these are the people who are providing jobs for the vast majority of Americans.
Yeah, so let's talk about the people that are watching this program right now. What does this truly all mean for them? Are they all going to be insured? Are they going to have an opportunity to get a good insurance plan, or what?
Well, here's an interesting fact, right? A person can opt out of the system, right? Then they pay a fine, right? So I opt out, I pay a fine. Guess what? Then I get sick, and I got to come into the system. Now, that seems to me a little bit absurd, especially because if I'm a person who's working, I'm going to pay a minimal fine, keep my salary high, and then once I get sick, I can go on now the government requires that I get health insurance, and so I get a pass. So, in other words, this puts insurance companies in a very, very difficult position.
Are you feeling sorry for the insurance companies?
Well, I got to tell you something. Insurance companies are owned by shareholders. Shareholders are people like you and me. And the fact is they're in the business to make money. I don't think that's a bad thing, that people want to make money. The problem is that what's the reason why health insurance companies have always said that they don't want to take people in who are sick, right, pre-existing conditions? The reason why they don't want to take people in with pre-existing conditions is because they won't be able to make any money, right? The only way that they can make money, wait, the only way they can make money with taking in people with pre-existing conditions is if everybody has to be insured. So what do? So now we have a system where you can actually opt out, pay a fine, so not everybody is insured, but what happens when you get sick? You can opt in. It is a very difficult system to justify.
Well, I think we'll see how that plays out, and the fine could be adjusted if it's too low. But there's no way that you can get the system that we have now without a mandate.
So now there's another question. So how many services does the government require you to buy personally? This is an interesting innovation that government is now requiring you to buy insurance.
Oh, well, do you drive a car?
I can choose not to drive a car.
Can you really? I mean,
I can choose drive.
I can do your job without a car.
There are a lot of people who use public mass transit.
So why don't you?
Because it's convenient for me, and as a result of something which is convenient for me, the government can require certain things of me for a license, not a right. A license.
But you don't have a choice whether or not to get sick. You don't have a choice whether or not to get treatment if you have a life-threatening condition.
A number of people in the states, I think on average, and I could be wrong about this, but like say 15% of drivers, even in states that have mandates, will just say, you know, I'm going to drive without insurance. If they catch me, all right. But there are some people, I think the incentives here are going to be incredibly complex. The law of unintended consequences has not been repealed. We don't know how it's all going to play out. There are going to be some people in these exchanges who I said before get significant...
You're talking about insurance
exchanges. So let's say the New York Insurance Exchange, just to make up a mythical one, say this one gets set up. Some people who qualify for it, who don't get insurance for their jobs, are going to get subsidies from other taxpayers to buy into the exchanges. And that means if you or I get it through our employers, that's coming out of our salaries and pensions. If I don't get it through my employer, taxpayers pay for it. That's going to create a huge imbalance, and people are going to say, hey, why is that person getting a better deal than I am when that's coming out of my salary? Get me into that exchange.
Paul, isn't that part of the cost control structure? I mean, we're all subsidizing people who don't have insurance right now as we're sitting here talking about it.
Yes,
people who have no insurance, who go to the ER, people who are homeless, people who have no jobs, people who are underemployed.
But then don't we have as Christians an obligation to take care of them? So are we just going in circles?
We do have an obligation to take care of people, but the question is, what's the extent of our obligation to take care of somebody who's ill?
Well,
that's really a question. See, it's a nuanced
for doing so. Well, I mean, right now, all of the costs are buried. You know, we don't really know because
you know why? Because the consumer is not incentivized. The consumer at this point is not incentivized at all in the process, right? Typically, the consumer being the patient, you would think would be incentivized to make sure they get the best price. Right now,
that's part of what the bill attempts to address.
Well, but the bill is going to cover people's premiums, you know, up till 90%. It's going to cover out-of-pocket costs. It also tells insurers what services they have to cover. Many more preventive services, community rating, guaranteed issue, which you just talked about. It's going to drive up prices. We want this. We want everything. We can't have everything. We can't say everything is available to everyone all the time at a low price.
But let's talk about some of the good things that this is attempting to do, such as the bill is going to help reduce the deficit. Medicare fraud will be cracked down on. Children will be able to stay in their parents' insurance policy until they're 26 because, as we know, most of them can't afford it when they get out of college or when they try to get their first job or out of school, and it's very hard. So there are some good things.
Yeah, you won't be kicked off of your policy in the middle of a chemotherapy treatment.
That's right.
That will not happen anymore.
Right. And so here's the thing is that you can take a look at this bill and say there are some really good things that are accomplished here, but on balance, it's a bad bill. And that's where there's really a crux of the matter. And here's the evidence, I think, that it's a bad bill. We asked 7 New York City congressmen who represent the people of Brooklyn and Queens to come on, talk about the bill. Guess what? No one would show up. So here's the thing. If it's such a great bill, you would think you'd want to come on and talk about what a great bill.
You've really sealed the case there with the 7 congressmen who couldn't find time in their busy schedules to be on our program.
Well, I think that here's a question: is that you can ask, that what's the busy schedule? They're on break. There are people around. They're having public appearances. I think there's or send a representative to come on the show.
Yeah. I think your point is that if this is something that has been is considered to be such a victory for the Democrats,
take advantage of it.
And for the people that are watching this program, then we should have an explanation about exactly how it's going to work and answer some of these questions that we've been discussing.
Yeah, they're hiding, and they've been hiding on this bill for a long time.
That's quite an amazing assumption. I mean, you can't jump from 7 congressmen wouldn't be on our show to therefore they know the bill is no good and they're embarrassed by it.
And I agree, there are some good things in the bill that I think people on both sides of the aisle would say, yeah, these are things we should do. Medicare fraud, helping people with pre-existing conditions get coverage. I mean, insurance works well when you're healthy, when you're in the program, in the same way that your fire insurance, your auto insurance works well before you have an accident or before your house is on fire. But some of the most important provisions on the bill don't kick in until 2014 when the subsidies and the exchanges get started. Other revenue-raising things don't kick in until 2018, the excise tax.
But aren't these all questions that are going to kind of be answered between now and 2014? Like, you can't just one day put them into effect because you've got to figure out how to make it work.
Well, Massachusetts actually phased in something very similar to what the president is doing, which was actually signed into law by Republican Governor Mitt Romney back in 2006. What they have seen happen is their emergency room costs have not gone down. Their premiums have not gone down. They've gone up. So now they're trying to switch to this capitated system. They're going to say, we're going to set a global budget for hospitals and physicians. We're going to have previous review of any insurance rate increases. We're going to try and run the system from the top down. I don't think you can do that successfully. Countries that have tried to do that have wound up with very long waiting lists and lack of access for cancer patients to new drugs, innovative surgeries, and other things like that. So you've got real questions. Not that you can't say, I want to switch to a different system, but you're going to have real trade-offs that you've got to try and account for.
And the American people need to be ready for that. But the fact of the matter is, our current course was not tenable. I mean, we could not continue. We were edging toward 20% of our GDP. That's where health costs are headed. Without this,
it's going to get there because the exchanges and the other things don't kick in until 20 after.
Every single opponent of this law basically rests their argument on negative assumptions, whether it was about how abortion would be funded or about cost controls, and.
But to be Grant, fair, there are concerns, and you know what? We are almost out of time, so make your point, and then I'd love to hear some last words from you.
No, so you're right. There are assumptions, but the president has said this bill will lower costs by $138 billion in the first 10 years and $1 trillion in the second 10 years. Those are enormous assumptions he's using to sell the bill. I think ultimately those are untenable. What I would say is if you think this is a critical problem that has to be solved now, and the president said solve this now, why don't the exchanges kick in until 4 years later? What we should have done is brought both parties to the table a year ago and hammered out a bipartisan solution and built on consensus and what works.
All right. Thank you so much, Paul Howard. We really appreciate you being with us today. You guys stick around because I think you're still going to be dueling. We'll be joined by our regular contributor, Elizabeth Scalia, and have some final thoughts about the healthcare reform bill. So stay with us. Welcome back. Continuing our conversation on the healthcare reform bill, we are now joined by the show's other regular contributor, Elizabeth Scalia, contributor to First Things and author of the blog, The Anchoress. I bet you've got something to say about healthcare.
I have something to say about everything. You know what? This has been very interesting. Both of you have been going at it, and I agree with some things that both of you say. I actually have agreed with Grant that there are some good things in the bill. I really love the idea that someone who's in the middle of a chemotherapy treatment is not going to have their insurance dropped. I think that's absolutely necessary. I also think you've made some very valid points. I don't understand why we had to do this enormous, vast bill and why we couldn't take this incrementally
one step
to see
at a time.
How it works. Let's start with making sure that people with cancer have coverage that's not going to be interrupted. Let's start with pre-existing conditions and then go from there. Why couldn't
I think
do that?
because the politics was driving. I mean, there is no question that the politics was driving this. And you know, and to be fair to the president, I think that, and even some, and to be fair on some of the rhetoric that was coming from people who opposed the bill, right? That a lot of people who opposed the bill on the grounds that it promoted abortion. They also were opposing. They used that as the. They were using that issue. They were, as you know, Bart Stupak said, they were politicizing the issue of abortion. The fact is so. I think that was unfair to the president. I think that while I think the issue of abortion was not appropriately addressed in the legislation,
You also think that they used it as a way
and I think that I think that was unfortunate because there was a lot of legitimate differences that could have been resolved.
Helped, but I think a lot of this could have been avoided had the president been more upfront about things. I think the president sitting there saying, "Well, there is an abortion in the bill." Yeah. Why not just say, "Yes, we're covering abortion. Deal with it." I would appreciate it.
They're not. That's why.
But they had to issue an executive order.
Well,
to correct that problem.
Well,
they didn't correct that. They didn't put that as part of the legislation itself.
You guys, honestly, there could never have been a bill that would please everybody. Come on.
Of course not.
Yeah, but
48%
of Americans are pro-life, so they could have tried to please 48% of America.
Well,
Instead, what they
now,
did is they took a country which was polarized, and they passed a bill which is a polarizing bill, and that's a fact.
Well, how do you explain how upset the pro-choice lobbyists are? I mean,
the pro-choice lobbyists the talking points are don't challenge the executive order until after the midterm elections. I mean, it's crazy.
Well,
it's
crazy. But because they are deeply concerned that this is actually a loss for them.
But it's the executive order. It's the executive order.
Listen to me, because what the bill will do is denormalize abortion. You will, if you want to get any kind of abortion coverage, you will have to write a separate check. You will it will become another, a secondary kind of procedure.
Right.
No, I mean, because you will have to jump through hoops that people haven't had to jump through
theoretically.
before.
But the question is going to be when that executive order is challenged in court, will it stand up? And there are a lot of people who say it's not.
Okay, so
I'm actually more concerned about the process. I'm more concerned about how this thing was done. My feeling is if the president had campaigned on this issue and sold this issue the same way he campaigned for president, which is in a unifying manner, in a bipartisan manner, as opposed to, I won, I don't really care what 57% of the country says, I'm getting this done.
Which he never said.
But don't you think, I mean, isn't the
All
bottom...
right, actions speak louder than words, Greg.
They do, and he worked quite hard. I mean, but as I said, the GOP made it clear that they did not want to participate.
When a country, I'm not even talking about the Republicans, I'm talking about
but he's
when
not
the
a wizard.
people,
How
the
does
country
he
is saying to you, we don't want this, go back to the drawing board, this is unacceptable, and he and Nancy Pelosi and Harry Reid basically say, shut up and sit down, we're doing this.
Well, then
that's a process I have a problem with.
Well, I have a problem with the polls that you're reading because they don't fit the ones that I've seen.
Okay, so what do yours say?
Mine say that when you start to explain to people what the bill does, they favor the various.
Okay, but here's the thing: that's right. That's the thing is
that doesn't make any sense.
Well, there are certain things that listen. We agree that we all agree a child who's just graduated college, they should be covered by health insurance.
Right, but
that's a good proposal.
But
that's somebody in the middle of.
How do you think you fit these pieces together? You think you get the insurance industry who pays $1 million per lobbyist? You think you get them to agree not to kick people off of plans without also expanding the insurance?
How much was the pharmaceutical insurance paying per lobbyist?
Both very valid points, but what I'd like each one of you to do is to take the opposite viewpoint right now and find something negative, you find something good.
This is an old parenting trick.
Yeah, come on, because we only have a couple of minutes
left.
Well,
as I said, I've enumerated a number of things that I think are positive. I think that people who have pre-existing conditions should not be barred from having health insurance. I think that's a real positive. I think that I was a college kid. I didn't have health insurance, and I think it's really a real benefit to ensure that kids have access to medical insurance. And I think 26 was a good age. I think that's about the time where people are getting on their feet.
You?
I would like to see stronger cost controls. I'm not convinced that the new competition is really strong enough to induce these insurance companies to lower their prices.
And Elizabeth, what about you? The process? Is there anything you can find
Was there anything in the process that I thought was good? I thought it was excellent that people got out there. I'm not a Tea Partier supporter per se, but I think it's excellent that people got out there and made a point of getting involved in the process itself. I'm a little sad to see that public outcry meant nothing, and I really, really hated the political theater of congressmen walking through the crowds with giant gavels in their hands just before that vote. I thought that was unnecessary and deliberately provocative.
And you think it's politics as usual, a lot of it?
I think it's all politics. The government of the people, by the people, for the people is being slowly turned into the government of sit down and shut up. You're going to do this, but we in Congress, your lords and masters, will not. We've accepted ourselves from this bill, and I think that's a serious flaw. How do you say to people, we're forcing you to do this, but we don't have to?
Another real
you.
positive thing, I think, are the health insurance exchanges that are being created here. I think that one of the problems that happened, perhaps, is when insurance companies became for-profits. Maybe really that health insurance companies need to be non-for-profits, and maybe that would really change the dynamic. And maybe that health insurance exchanges would provide that incentive.
And that's going to have to be the last word. You guys kiss and make up. Thank you all for joining us. We really appreciate it. And remember that you don't need a TV to watch the net. We are always online at netny.net. For all of us here, I'm Jane Hansen. I'll see you next time in the arena.